Welcome back to Great Day. A missing tooth can be part of everyday life for many rodeo performers who can get tossed around by an angry bull or an angry horse. Before the break, I asked, what should you do with a tooth that has just been knocked out? Here with the answer and some things our teeth might be trying to tell us about our overall health is Dr. Terri Alani, also known as the Texastoothlady.
Hello.
All right, hello. I've seen it happen during some of these rodeo performances. Tooth is popped out. If we ever lose a tooth, what do we do?
Okay, first of all, it's why we recommend sports guards, but what you want to do is you want to keep it moist, don't touch the root. You can put it in milk if there's milk, or you can actually put it inside your cheek.
Yeah.
And you want to see the dentist as soon as possible. The quicker that tooth is placed in, the longer it will
Because you could actually save that tooth and have it. All right, good. Dr. Alani, you know, oftentimes you say dentist, right? But when you look in the mouth, you almost become several doctors because there's a lot of things that you can find out about people. Let's just start with bleeding gums, for example.
Okay,
what does that tell you?
Let me just say, the mouth is a gateway to the body. So long are we just about the mouth, exactly. So bleeding gums, healthy gums don't bleed. That's number one. If you have periodontal disease, it is the #1 cause of bone loss. It can result in bad breath and also infection. And the #1 thing to know is the bacteria that causes inflammation in your mouth is the same bacteria that can cause inflammation in your arteries and lead to your heart.
Yeah.
So it's very important that you take care of it. And you can do it by seeing your dentist regularly. And also there are prescriptions called Periostat and also injectables called Atrodox that can go in between the gum and the tooth to help.
All right, bad breath. Obviously, we can eat things with onions, garlic, all that type of stuff, but this is a different type of thing. It's like after you've brushed your teeth and you still have that bad breath, that might be telling you something.
Exactly. It could be a sign of, if it's a fishy smell, it could be a sign of liver disease. If it's a fruity or acidic smell, it could be a sign of diabetes. It could also be a sign of acid reflux. It could also be a sign of certain types of cancers or an autoimmune disease. So if you have bad breath and it goes for a long time, or of course gum disease, it's really important to see your dentist and get it addressed.
At one time I had a real bitter taste in my mouth and it was almost metallic, and we figured out that it was actually the minerals I was taking.
Absolutely.
So some
and it could be a vitamin deficiency. Yes.
All right. Dry mouth, that's telling you something too.
Okay, a dry mouth could be an early sign of diabetes. What happens with diabetes is the blood vessels get constricted, and so it inhibits the production of saliva. So it's very important. The other thing with diabetes, if you're a diabetic and your gums are out of control, it's going to affect your blood sugar. If you take care of your gums and you're diabetic, it's going to help stabilize your blood sugar. So
and of
that's
course, when you're
really
diabetic,
important.
we know that there are certain things don't heal as quickly, so you have to be really on top of this.
Yes.
How often would you suggest somebody who has either periodontal disease or who might be a diabetic to get their teeth clean?
At least every 3 months. Really important. The other thing with dry mouth, it could be a result of medications such as high blood pressure medications, antidepressants, or it could be a sign of Sjogren's syndrome, which is an autoimmune disease, and it affects women over 40. What happens is the disease attacks the glands that produce saliva and also tears. So it's something that you need to address. Now, there's products that you can get through your dentist. One of them is biotin that can help stimulate that saliva flow, because when you have dry mouth, it can cause more cavities.
Yeah, and getting it from your dentist, there's stuff that's over the counter, but it might not be the strength that you might need, right? So getting it from your dentist is a whole nother level.
Well, one over-the-counter remedy would be sugar-free gum.
Oh, really?
Sugar-free gum does work, yes, because you need to get that saliva stimulation.
Yeah, you said this is women over 40?
Yes,
okay,
Sjogren's.
so I have a couple of years left then. All right, ulcers and recurrent sores also, you know, oftentimes people say there's too much stress. They can be stress related, but there's other things that can cause that too.
Well, we all have stress.
Yeah.
So the #1 thing that causes the stress, of course, you get the aphthous ulcers or you get the herpes virus, and that's on your mouth. Let me show you something. This is a laser. This is a laser. It's like a pen. And basically what we do is we can actually, you can stay closed. Let's say you have a sore on your lip. We just take this, with 4 passes of 30 seconds each. We don't even touch the lip. The heat deactivates the virus, and that herpes virus will no longer appear in that area.
So as soon as you feel something coming on, right?
Yes, new technology. The other thing is oral cancer. Oral cancer kills 1 person every hour in the United States.
Wow.
The
That's
sooner it's detected,
I think people don't think about
what you need to do is if you have an area that does not heal, if you have a red area, a raised area that has a red or white border, you need to talk to your dentist. And we also have other technology. This is a Velscope. There's many devices that can detect. And basically what it is, it's a UV light. Go ahead and open. And we go ahead, yes, and we can shine it in, and it's going to highlight the suspect areas.
Yeah, which is another reason why it's good to go to your dentist regularly so that you can find those things,
And your
right?
dentist should be doing an oral cancer exam every time you go in to get your teeth cleaned.
All right, cracking, loose, or flat teeth. If you haven't been having teeth that crack easily growing up, then something's changed.
Okay, so again, it's more mental than physical. It has to do with clenching and grinding. And you should see your dentist, wear a night guard, that's gonna help. Of course, you can also do Botox in those areas. And last but not least, do not chew ice.
All right, and what do you do with the leftover Botox?
With leftover
Put it where
Botox,
you need it. Yeah,
right
put it where you need it. All right, white webbing on the inner cheek.
Okay.
These are a lot of things that people don't even really look at. So again,
They
going to
don't
the dentist
look at,
to see
but
it.
we see it.
Yeah.
And that is common in women 30 to 70, which is, basically all women. And it's webbing on the inside of the cheek, and it's not contagious, it's really annoying, and there's no cure. So I don't even know why we bring that up.
All right, we'll get rid of that one. All right, the white coat on the tongue.
White coat on the tongue. If you have gone through a long course of antibiotics, what happens is the fungi end up oversupply. It's called Candida. It's very simple to take care of. It's a mouth rinse called nystatin. It's a prescription. It's called Thrush, and you can get rid of it very easily.
All right, you mentioned the mouth is a gateway, and the dentist is a gateway at times too, because one of the things that you do in your office is you take a person's blood pressure.
Yes,
and there are
we
times
do.
that you've sent people, got them out of the chair and sent them straight to a doctor.
And they get very upset at us, but I will tell you, we save lives. It is the #1 silent killer, and a lot of patients don't realize that they have high blood pressure. So that's important. Oral cancer exams, high blood pressure by your dentist.
All right, Dr. Alani, thank you very much.